All right, we are back again for another segment here for Endometriosis Awareness Month. Thank you, Andrea, for sticking it through and teaching us so much so far. I feel like hopefully those who have been following have learned a little bit more about what it is, how it can be diagnosed, sort of different misconceptions. And now I feel like one really important part is really what we can do to manage when we do get that diagnosis. And if we have gone further with the surgery to sort of confirm that it is some of the pain that we're having is due to endometriosis. And we did just want to put out a disclaimer. We are not medical doctors and we're not prescribing or being prescriptive here. We're just talking about what the community knows of what can be helpful to treat some of the symptoms.
Yes. So since endometriosis affects everyone so differently, it's, not a one size fit all type of thing in terms of how to manage the pain, since there is no cure yet. Hopefully we will get there. But there is no cure for endometriosis, even after excision surgery, which is the gold standard of treatment. So over the years, it's just been trial and error for me, talking with others in the endometriosis community about what helps them and their specific symptoms. For my very chronic nausea, peppermint tea is something that I always keep in my toolbox. I always have some at home. I've got some in my drawer at work. I've also been prescribed some anti-nausea medication from one of my doctors. They can also prescribe, some heavier painkillers if that's what's right for you. For myself, because I have such a sensitive stomach, I sort of try to avoid those sort of heavier opioid painkillers until like the very last second, which sometimes I do end up having to take them. I just have to make sure I have something in my stomach first. But part of the reasons why I relocated to the state of New York is because there is the medical cannabis program here where you can be prescribed medical cannabis and, become a certified medical cannabis patient to help sort of manage a lot of that pain that way. I always have a heating pad at work as well. Got one at home. In all of the spaces of my life, there's a heating pad. I also have a little portable TENS unit. I keep one at work and one at home. Do you want to explain what a TENS unit does, Erin?
Sure, yeah. So TENS is basically just an electronic stimulation that sort of confuses the brain from feeling those pain signals. So it's typically a topical. You put it in the area. So if wherever your pain is mostly, you could. The nice thing is you can apply it to that area through these little electrodes, and then depending on your tolerance, you turn it up to where the electric stimulation is confusing the pain signals from going to your brain, so that you're really not feeling the pain, but you're feeling this other electric stim. So as in PT, it's a common thing that we use as well.
And that's actually where I picked it up because I was attending physical therapy. I'm like, this actually helps quite a lot. So they do make, like various pharmacies, Walgreens. I think I got one at Walmart actually too. They have little portable TENS units. There are various topicals that sometimes are helpful to people. CBD salves, magnesium sprays. Some folks use like a topical analgesic, so it sort of numbs the area. It doesn't help everybody, but you sort of have to try and figure out what works for you. For example, I like heat more than I like ice, but some people prefer, having an ice pack on their abdomen or wherever they're having pain. I get a lot of lower back pain. So something that, again, one of my physical therapists recommended for me is cupping, which I don't know how deep we want to go into what cupping is, but it's essentially creating some soft tissue mobilization so it can sort of work through any scar tissue or adhesions, bring more blood flow through the area to sort of help alleviate some things. Doesn't work for everyone, but I found it helps my lower back quite a lot. Let's see.
Are you sure you're not a PT? You explained that very well.
Oh, thank you. So yeah, just having a lot of different products that work for you in your arsenal is super helpful. For myself, during my period, I end up losing a lot of blood, which when you're trying to have a career and you're working, having specific products that help you is like a game changer. I've tried a few products over the years, but what I like most are Thinx. It's spelled Thinx, and they're actual like menstrual panties that you can wear. They come in like boxer style, regular sort of briefs. But especially for someone who's concerned about any, leaking or anything like that, it's a huge game changer and gives a lot of peace of mind. I always kind of focus on my nutrition as well. I want to make sure that I'm fueling my body with the right things and not sort of giving it things that are going to trigger my system. Everyone's system is absolutely different. And, my friend with Endo who, they might be able to eat gluten, whereas gluten really bothers me. So that's something that I've eliminated from what I bring into my system. I like to keep things for myself very anti-inflammatory. So I don't consume any gluten, dairy, any soy products because that contains phytoestrogens, and endometriosis is an estrogen dominant disorder. So I'm not trying to bring more estrogen in my body. I'm trying to get rid of any excess, which again, it's very important to have a healthy colon, make sure things are moving through. So, probiotics can be helpful, magnesium can be helpful, just making sure that your body is operating and getting rid of that excess hormones.
You are such a wealth of knowledge about all of this. And so what I'm going to recap here is obviously Endo. I like that. Okay, so there's an abbreviation. Thank God, because feel like I've been flubbing with the word. Like endometriosis there is no cure yet. So learning how to manage your symptoms, whether it's hot pack, cold packs, different opioids, medical cannabis, different types of teas for the nausea, peppermint tea, as you mentioned, and other sort of physical or type of pain relieving, like acupuncture. I know you didn't mention that on this segment. You told me that before. Acupuncture, cupping, any ways to sort of reduce the tension also in those areas are tools that you can use to try to find your own mix of your symptom management.
Absolutely. Yeah. Another thing is making sure that you're hydrated enough and get enough sleep. You definitely cannot prioritize those two enough. My sleep schedule is usually very regimented just because I want to give my body enough time to recover from whatever it went through that day to lead me into the next. So hydration, I think we all can do with more of that. And then definitely prioritizing your sleep to let your body sort of rejuvenate itself.
Oh, well, I appreciate doing this because I know it's nighttime and I'm like, oh my God, what's your bedtime? All right, we'll speed it up. All right, we've got a couple more segments, guys. Thanks for following along. Bye.